Namaskaram. Welcome to Teach-Trick UPSC model. What happens when medicine becomes a political weapon? U.S. President Donald Trump has announced 100% tariffs on imported patented medicines, a move that could shoot up medical bills in America and shake up global pharma trade. For India, a generics powerhouse, this brings both relief and new uncertainty. Let's decode this issue for UPSC. The Hindu editorial explanation: weaponizing health. Americans will see medical bills shoot up due to Donald Trump's actions. Background: U.S. healthcare context. Prescription drugs equals approximately 10% of household medical spending. Trump's decision: 100% tariffs on patented, branded medicines from October 1, 2025. Exemptions: imports from EU and Japan capped at 15% tariff. They account for 75% of pharma imports. Targeted countries: UK, Switzerland, Singapore. Right-pointing arrow face full tariff burden. India's role: world's largest generic exporter, supplying $10.5 billion worth of formulations to US in FY25. Main News 1. Impact on the US. Prices of cancer, rare disease, and diabetes drugs likely to soar. Health insurance premiums may increase as companies pass on higher drug costs. Ernst & Young study: 25% tariff equals plus $51 billion annual costs. 100% tariff could double that burden. 2. Global impact: UK, Switzerland, Singapore. Right-pointing arrow competitiveness hit in US market. Pharma supply chains disrupted, creating ripple effects worldwide. 3. India's position: generics spared, for now. They account for 90% prescriptions but just 13% drug spending in US. Risks: if tariffs expand to cover generics or APIs, India's pharma exports may be hit. Opportunity: countries looking to diversify from US may seek Indian partnerships. 4. Political and strategic angle: Trump's move ignores industry body Pharma's warning. Reflects larger trend of weaponizing trade and supply chains. Highlights need for India to diversify trade alliances, BRICS, Global South, EU partnerships. Conclusion: solution for the US. Tariffs may backfire by raising domestic health costs without fixing supply chain gaps. For India, diversify export markets beyond US dependence. Invest in APIs and biosimilars to reduce vulnerability. Strengthen ties with Europe, Africa, and ASEAN for pharma trade. Global lesson: health security should not be compromised for political gains. Medicines must remain affordable, accessible, and insulated from trade wars. Medicines, a necessity for life, are now caught in the storm of politics. With Donald Trump slapping 100% tariffs on imported patented drugs, Americans will pay more, and global pharma trade will shift dramatically. For India, the world's pharmacy, this is both a relief and a warning. Let's decode the health, trade, and UPSC relevance of this critical issue.